Welcome to The Explainer. We're jumping right into testicular cancer today. Now, you've probably heard it's one of the most curable cancers out there, and that's true. But what's really fascinating, and what we're going to unpack, is a brand new story that's emerging about who is actually most at risk right now. So, let's kick things off with a question. Think about men in the US, specifically between the ages of 15 and 40. What do you think is their #1 most common cancer? Take a guess.
All right, you ready for this? The answer, and this catches a lot of people by surprise, is testicular cancer. So today, we're going to break it all down. Who gets it? How do you find it? And maybe most importantly, how are treatments getting better? And believe it or not, even more convenient.
Okay, so to get a little more specific, we're really talking about something called Testicular Germ Cell Tumors, or TGCTs for short. These are the big ones. They make up over 95% of all cases, and they start right in the cells that produce sperm. Now, here's the thing that's kind of wild. Overall, testicular cancer is pretty rare, right? It's only about 1% of all cancers in adults. But if you zoom in on guys between 15 and 40, it's the single most common solid tumor they face. And that's exactly why being aware of this, especially in that age group, is just so important.
So, for years and years, we thought we knew exactly who was most at risk. The data was consistent, it seemed like a settled issue. Well, get this. A major new study just came out and basically flipped everything we thought we knew completely on its head.
I mean, for decades, it was textbook stuff. Every doctor, every researcher would tell you the same thing. Non-Hispanic white men had by far the highest rates. But the newest data, it's telling a totally different story.
So what's behind this huge shift? It really boils down to this one number. We're talking about a 3.03% average increase in cases among Hispanic men. That might not sound like a lot, but it's been happening every single year for almost 30 years. That's not a blip, that is a steady, relentless climb. And when you see what that steady increase actually looks like over time, wow, it's striking. The rate for Hispanic men more than doubled. It went from around 3 cases for every 100,000 men all the way up to more than 7. That is a massive jump.
So what this all adds up to is a really historic moment in the data. For the very first time on record, Hispanic men now have the highest rate of this cancer in the United States. And you can bet researchers are scrambling right now to figure out why. What's going on with environmental factors or lifestyle or something else that could be driving this.
Okay, so knowing that the risk landscape is literally shifting under our feet makes this next part even more critical. Because no matter who you are, the absolute key to the incredible survival rates for this cancer is one thing: catching it early. But here's the problem. That early detection doesn't always happen. It's actually kind of shocking. One study found that a full quarter of patients, 25%, waited over 6 months after they first noticed something was wrong before they went to see a doctor. 6 months!
And that delay can be so risky. The thing is, the early signs are often really subtle, like a painless lump that's super easy to just ignore or put off. And this is precisely why things like monthly self-exams are preached about so much. They are just a crucial tool for catching this thing early.
But imagine, what if we could find it even earlier? What if we didn't have to rely just on physical exams? Well, this is where some really cool science comes into play. Specifically, research into something called MicroRNAs. Think of them like tiny little messengers floating around in your blood, and their levels can go haywire when cancer shows up. And get this, scientists have now zeroed in on one specific microRNA. It's called miR371A3P. The research is pointing to a future where a simple blood test that just measures the level of this one little thing could be an absolute game changer. We're talking about diagnosing and monitoring the cancer with unbelievable accuracy.
All right, so let's shift gears. A diagnosis is made. What happens next? What's the battle plan? The good news is the treatment for testicular cancer is one of modern medicine's biggest success stories. We've been getting better and better at fighting it for a long time.
For a long time, the gold standard, the go-to weapon for cancer that has spread, has been a chemotherapy cocktail called BEP. It's famous in the world of oncology because, frankly, it works. It has led to incredibly high cure rates and really changed the game.
But there's a catch. The standard way of giving BEP is, well, it's a huge pain. Patients have to come into the clinic every week just for one of the drugs. So to make life easier for patients, researchers looked at a different way of doing it.
What if they could just consolidate everything into one single 5-day hospital stay?
And you know what? The results were fantastic. A big study showed that this much more convenient schedule worked just as well. For patients considered good risk, more than 91% had a great response. That means their tumors shrank, their markers went back to normal. It was a total win-win.
A lot of times, the strategy is like a 1-2 punch. First, you hit it with the powerful chemo, the BEP, which goes after cancer cells anywhere in the body. And then you follow up with a very specific surgery to go in and remove any stubborn bits that are left behind. It's a really thorough approach to get the best possible shot at a cure.
So when you have a playbook this powerful and this effective, it means the long-term outlook for most guys is just incredibly positive. It's really held up as a model for how to successfully treat and cure a cancer.
And I mean, this number really says it all, about a 96% 5-year survival rate. That's for all stages combined. It's just an amazing testament to what early detection and modern medicine can do.
But, and this is a really important but, those amazing results aren't shared equally by everyone. When you dig into the numbers, you see some serious disparities. The survival rates for Hispanic men, and especially for non-Hispanic Black men, are lower. And a big reason for that seems to be that the cancer is often found at a later, more advanced stage.
So when you put it all together, the big takeaway here is really a story of progress. It's empowering. We're understanding the shifting risks in a way we never have before. Our ability to detect it is about to take a giant leap forward. And the treatments, they're constantly getting better and easier on the patient.
Which really leaves us with one final, very hopeful question for the future. As we keep learning more about this disease, with the risks changing and the treatments evolving, could that simple blood test we talked about be the final piece of the puzzle, the breakthrough that helps us finally, truly conquer this cancer for everyone? All the science seems to be pointing in that incredibly promising direction.